Swelling after knee replacement is common, pretty normal in most patients, but some people get a lot of swelling on the outside of the knee, lateral aspect of the knee. Looks like a big goose egg. It's concerning. Patients are scared. What is it and why does it happen? Stick around. Hello and welcome back to the channel. I'm Adam Rosen. If you have not already subscribed, please subscribe. Gives you updates when these new videos come out. And if you enjoy this content, click the thumbs up button. It really helps people like you find content like this. In today's video, I'm going to talk about something briefly because it doesn't happen to all of you, but it may happen to some of you. And that is specifically swelling on the outside or lateral aspect of the knee. And we're not talking a little swelling. We're talking like goose egg swelling, kind of baseball swelling on the outside of the knee. This is something that really concerns patients and they get scared. They wonder what it is and what caused it and what happened. So some patients, and we see this more frequently in young adolescent females, teenage girls, they have what's called patellar tilt. And what happens is the kneecap is tilted, and if they have pain, what's called anterior knee pain syndrome, one of the treatments that we have available is doing what's called a lateral release. We typically do this arthroscopically, where we cut a little band of tissue to untilt the kneecap to get it to lay flat, distributes the forces on the cartilage, and hopefully relieves their pain or symptoms, and may even decrease the chance of arthritis as they get older. Now, in the knee replacement world, we typically see this in patients that are knock-kneed, or what's called valgus. And you can see here that this lady is significantly knock-kneed, which means that the tissues on the side of her knee are very tight. So as I go to straighten her knee at the time of knee replacement, those tight tissues are going to have a tendency to pull the kneecap off and out to the side. And these are the patients where typically we have to do a lateral release. So just know that if you're bow-legged, doctor probably is not going to have to do a lateral release. If you're knock-kneed, there's a good chance that the doctor might have to do a lateral release. So you might be a patient that's prone to develop this swelling on the outside of your knee after surgery. Now, when we're doing this surgery, again, we're assessing lots of things: the spacing, the alignment, the balancing, the sizing, and the tracking of the kneecap. So it's a decision that's made at the time of surgery as to whether or not this procedure has to be done. Now, what are the risks? One of the major risks that a lot of people talk about is what's called avascular necrosis, because as we release this band, there is a little artery there, and the concern is that that could compromise the blood supply to the kneecap. I personally haven't seen this in any of my patients, although the data reports this is around 4%, and it can happen, so it's something that you should be aware of. Now, when you have knee replacement surgery and you go home and a couple days later, because this typically happens a couple days after surgery as the knee starts to swell, where we've made that little cut or the rent, blood can seep out through that hole. And as you bend your knee, because it's under pressure, it forces the blood through the path of least resistance. And that's why it gets trapped outside the knee joint or outside the knee capsule, but underneath the skin. And patients will see this big ball or goose egg sticking out on the side of their knee. And that's what this is. This is a swelling or what's called a hematoma from the lateral release that was performed at the time of surgery. Now, what I have found over the years is the most important thing is patient education. Anytime that I do this, I let the patients know after surgery that I did it and that they might see this after surgery. I also put it in my operative note. Under the procedure is total knee replacement and lateral release. So if a patient calls my nurse and I'm in the office or the operating room, the nurse can look at my operative note and very quickly see, the doctor did a lateral release, and explain what it is to my patient and what the treatment is. And again, I educate on my patients from the beginning. So like all patients, ice and compression is really important, but specifically in these patients, I recommend compression with a knee sleeve for at least 2 weeks. That really prevents that area from blowing out and getting swollen. Because once it's swollen, it's hard to get the swelling down in that area. But if we can prevent the swelling from occurring in the first place, then you never have to worry about it in the first place. So I hope this answers some of the questions that some of you might have. Any of you out there with a knock-kneed knee or a valgus knee may have a lateral release performed at the time of surgery, so you might be prone to this type of swelling. And now that you know what it is, you can ask your surgeon about it, and you can be more aggressive and treat it proactively to prevent it from becoming a problem in your post-operative recovery. Thanks again for watching, and thanks for tuning in. Until next time, I'm Adam Rosen. Stay safe.